You, Dr. Chirunda.
It's my pleasure.
Thank you so much for choosing to come and address the public about what is going on. Please introduce yourself to the public.
Well, like you said, I'm called Dr. Chirunda Daniel. I'm a graduated medical doctor awaiting internship 2026 and 2027.
On that particular note, most of the people think that interns are actually students. You are graduated.
Yes, please.
And you're saying you're waiting to do internship.
Yes,
I'll clarify that to our viewers.
Unlike other areas, for medical interns, these are people who have gone through the entire training of the course. For example, I would give an example of myself. I finished the 5 years of Bachelor of Medicine and Bachelor of Surgery. And I do possess whatever it takes to personally have been able to graduate. I have my degree.
You graduated already?
I graduated already,
okay.
Yes. And I have my degree certificate with me. And I also have a provisional practicing license from the council, which is Uganda Medical and Dental Practitioners Council, which I'm meant to get before I go for an internship. But I have to undergo that mandatory 1 year of internship to working or giving services, but under the supervision.
So that internship takes a period of 1 year?
1 year only.
Okay.
Yes, please.
So you're actually not students. You've graduated and you're mandated to have that particular year practicing in hospital.
Absolutely,
Now,
yes.
we'd love to understand, paint for us a picture, day in the life of an intern. I mean, what exactly happens?
A medical intern is basically, I don't know how to classify, but is a very busy individual who offers service that is beyond the normal working schedules of other cadres.
Yes.
For instance, the duties of medical interns normally run between 36 hours. Actually, 24 to 36 hours, non-stop before one takes a rest. So that is basically the life of an intern as compared to others. Now, when you compare the time or the number of hours worked, I mean, an intern is able to execute in the execution of his or her duties, it is almost 5 times the normal working time of any other working person in this country. So these are guys who hardly have time to even think or even to, rest. Yes, please.
And how many hours are you actually supposed to work?
Ideally, it's meant to be, under the normal working conditions, it's meant to be 8 hours per day. And of course, 5 times a week. And that will go for, that's about 40 hours in a week. A medical intern does 180 hours. That's the minimum, but it goes even 200 and beyond, because we may not have much, like the off duties, just like other workers, whereby they do, and they are mandated to at least 2 days of off duty within the course of the week. For us, we don't have such. Yes.
And we love to understand why is this even a big deal? Why is why are the allowances a big deal?
That is equivalent to asking that why is fuel a big deal in a vehicle?
Because one would actually ask that this internship is actually helping you as a doctor. You're gaining the experience in a hospital.
Well, I would not dispute that fact because we needed to work under supervision of consultants to be guided on our next course of operation. But you should not forget that we do offer service. We offer service that is, that cannot go unvalued. Like we've noted before, that we are already graduated, we have our documents. Now, obviously, any other person who has finished school and graduated and has his or her documents, the next thing would be perhaps the service the person is mandated to, expected to have, is expected to come with some stipend or a wage. So much as we need it as a mandatory procedure that we must go through this internship, but we offer services and we think we need to be facilitated. Actually, this is just a facilitation for us to do that, because you can't execute those hours, as I've said, when you have no means of survival Means of survival, yes, because interns...
On that particular note, our viewers would love to understand, what does even allowance, pay for as an intern?
I beg your pardon?
What does this money that the allowance pay for?
What it pays for? Just for the basics of life. Food, and those are basically meals. Accommodation, airtime, and transport.
And how much are we looking at?
As it stands, or what we have been able to...
As it stands.
As it stands. Previously, it was 1 million.
Yes.
Which is far below what was agreed upon in 2021. That was
2.5.
Yes, which was a presidential directive. Now the 2.5 was arrived after a negotiation, and the president found it wise that these people offer tremendous service, and therefore they should get at least 50% of what the cadres of government who are on payroll get.
Yes.
And by then, of course, it was 5 million. So 2.5, 50% would be 2.5 million.
Yes.
As a facilitation for them to execute their duties. It happened for a year. Afterwards, it was...
The money was cut to 1 million.
Yes, we don't know under what circumstances. There was no any other directive towards that. We didn't have any document that was recording that, but we just happened, so it happened that way. And they have been surviving, of course, painfully or harshly on that 1 million. Of course, you know what that means according to the current costs of living in the country. But they have been surviving on that, at least painfully. However, this new, what we call the NET policy, or national education and training policy, health for policy, has been, it has come along with the scrapping of that 1 million.
Yes.
So meaning from 2.5 to 1 million to 0.
Now, we got to see that the Minister of Health, Dr. Chris Badiomosi, came out and he was addressing the public that before you people get out to maybe demonstrate or something, you should be able to understand the breakdown. And he came out and said that interns on government that have been sponsored by government will continue to get the allowances, and those that have been sponsored privately, there will be lunch money that that will be given. So I don't know where you fall, if you've been sponsored by government or you've been sponsored privately, and where does that leave you people as interns?
That one, first and foremost, it's not only malicious, but it's unethical, and such shouldn't have come from our leaders. First of all, what does he or what do they mean by lunch money and vis-a-vis the others? Is he reducing medical interns to beggars or people who have nothing to eat as the only reward? Now, first and foremost, it is discriminative. You cannot say that you are going to facilitate. No, this is a facilitation. It's not a salary. That you be able to facilitate one who had previously studied under government sponsorship, and you will not facilitate the one who supported, who studied under private sponsorship. Yet they do offer the same services to the nation. They do see the same patients, and they attend to the same workload. It is, I don't know whether how. That's just a misnomer, because what would happen if the ones who are in private say that, okay, since we are not offered anything, we shall work less? It will be a very big catastrophe, even for our supervisors, our seniors in the government. I mean, in the health facilities, who are the consultants, who are supervisors, because it will be hard for you to harmonize and supervise equally. One, a starving medical intern, and one who has gotten something. It just beats logic, doesn't make any sense at all, and it is regrettable that it was suggested by those authorities. It shouldn't even have come from them, because now, first of all, how many started on government sponsorship? They hardly reached 400, 500, yes. We are deploying this year, we are about 2,470 something medical interns. So, in their wisdom, they do thought that the 400 are the ones who are to be facilitated. Now, what informed that decision? What informed that decision, for example? There is no basis for saying that, and I think, and that's why we are making an appeal to the concerned authorities, to the cabinet, and the August Parliament of Uganda to reject such proclamations, such statements that are discriminating. Because now it's going to affect our health service, I can assure you. You will not expect me, for example, me and you are seeing the same patient and doing the same workload, and you expect you are paid them not, your facility are not facilitated. So how do you expect me to execute duties as you? But
now, I'd like to ask Dr. Chirunda, if government stops these allowances, or they've come out and stopped the allowances, does that mean you cannot work?
It greatly impairs our ability to serve.
Yes.
Effectively, because health is this not casual labor, or we are dealing with the lives.
You're dealing with lives of people.
Lives of people.
Yes.
And life matters a lot. Now, you will not expect a person who's not facilitated, for example, and hungry, near the collapsing medical intern, to stand in the theater for possibly 8 hours and 9 hours without having gotten something to eat. And by the way, it is not only eating. It's not only eating. Like I've said, we do need the accommodation. Now, and transport, because we find some facilities, most of them don't have accommodation. So one has to rent somewhere and has to transport him or herself to the working station. So how would you expect a person to reach there? So all in all, this one is just in this. Just like fuel in a vehicle. It's not a luxury. It's just to enable us be able to execute. So you removing it will greatly impact that service delivery. And our ability to be able to offer services. It shouldn't be an option.
Now we bring it back to the patient. You said you're not reporting. What happens to the patient if you people are not reporting?
Well, first and foremost, we are not just refusing to report. We are saying we do want to report, but we want to report under clear circumstances of how we are going to be able to execute our duties in terms of the facilitation. And that one, we are not asking for much. We just want to be enabled. What happens to you ask, what happened to patients? Obviously, when medical interns offer approximately 75% of the work in these government facilities. Now, if that service is withdrawn by any circumstances, whether delay in reporting or any other circumstances, you can see what it means in terms of service, not necessarily delivery, but acquisition from the patients. Obviously, we shall have them not being attended to by medical professionals who are medical doctors, dental surgeons, pharmacists, nurses, and midwives. In simple terms, it will just worsen the health situation in the country, which is already burden based on the doctor to patient ratio, and therefore we may have complications, but above all, the mortality rate would go high, and we don't want to reach there. We want to go and offer service, because that's why we went to school. We didn't go to school simply to to occupy some offices and maybe go on the streets and do. We are not activists as such, but of course we can do activism in case it's needed, like in this to serve the people. So we want to report, we want to offer services, we want to contribute to the development of this country, more so in the health sector, but we want to be facilitated. So we are very much willing to report for as long as government is able to facilitate us to do so.
That and more stories that we are still having with Dr. Chirunda from King Caesar University. A lot more that he has emphasized on. He has stressed that these particular people are non-students. They are interns that have graduated already, that are seeking justice. They need to be facilitated in order for them to execute their duties. That and more particular conversations that we're having in this particular edition of New Day. We do take a short commercial break. We are coming back with more conversations about this particular story. Welcome back from that commercial break. You're still watching New Day on TV1. See the difference. We are still with Dr. Chirunda, and we're still discussing some of the matters that are happening with the intern doctors. And we love to watch a certain video where Dr. Chris Badiomosi got to visit a particular hospital. I don't know if our producer does have that particular video. But still, we would love to understand. We saw Dr. Chris Badiomosi. I think it was Western Uganda where he got to visit a particular hospital, and he found the askari, the one attending to the patients, and then the the intern doctors. What does that actually tell us about the current situation?
It simply tells you how committed medical interns are in as far as...
On your screen, that is actually Dr. Chris Badiomosi that was talking to some of the patients, and doctors were not there. He got to find that it was only intern doctors and an askari that was actually attending to these particular patients. What does that tell us about the current situation?
It simply tells you that actually that should have even informed their next step, that medical interns are indeed a very big task force, and they need to be facilitated to be able to do much of that. Now, that incident, particular one, happened because the minister was able to visit that facility at night, and it was being covered. But that's what happens everywhere in most of these health facilities. Medical interns are always there on duty, like I've said, 36 hours, sometimes even 48, non-stop. So whether you got 2 p.m. or a.m., 4 a.m., you will find them there. You will find the same people who were there during morning. So to me, that wasn't a surprise, and but that as well should have informed them that we really care of our people, because we are managed to do so. So we shouldn't, by now, we should not be really talking about us being enabled to be able to just go and offer that service, because that's what happens every day.
With the current situation that is happening in Uganda right now in the medical sector, would you actually advise a young person that would love to get into this particular field to take it on?
Yes, if they do. I mean, if it's their passion, because say being a health worker is a calling. Yes, and that's why we are not asking for wealth. We are only asking for survival. Yes, to be able to execute our duties. So what is happening currently, it shouldn't discourage those young lads into coming to the profession. But our leaders should know that what is happening year in, year out about medical interns demotivates many into coming into the field. Yet the patient to doctor ratio is really appalling. So I would encourage the young people to come on board so that we offer services. Yes. On
the particular note, you're the secretary of Federation of Uganda Medical Interns, right?
General Secretary.
The General Secretary of Federation of Uganda Medical Interns. Yes. What would you want the President Cabinet in this particular matter, or the Ministry of Health, to hear from you today?
Well, first and foremost, I'm the interim General Secretary.
Yes.
Our seniors are about to hand over to us. So, I mean, and we are set to organize ourselves, and then we go into that, make that leadership action. What I would like the cabinet, the president, to hear from me is, one, we are an integral part in the health service delivery in this country. We undertook this cause to be able to deliver services.
Yes.
We are not asking for too much. We are not asking for wealth. We simply need facilitation to be able to execute that. And therefore, in my humble appeal to the decision makers, is that take the plight of the medical interns into consideration. Take the public outreach seriously. We need to offer services, and therefore we ask for that. One, not only the facilitation. By the way, we have tried to localize or concentrate on only the facility in terms of the allowances, but the entire health policy this NETH policy. The NETH policy is catastrophic. And therefore, we ask the cabinet and the formulators of this, especially the Ministry of Health officials, together with the Ministry of Education, to recall this policy and do a revision in this policy. Because the way it is simply, it promotes slavery and it actually disorganizes service delivery. So the policy has to be withdrawn and revisions are done after making some thorough consultative processes. And that's what we're asking for. We are not saying that we are only targeting or aiming at facilitation or allowances, much as it is very much needed. But this policy needed to be reviewed. And that's our call to the government and stakeholders. Yes.
Okay. Doctor, if in any case the ministry does nothing about this particular situation, what is next?
What do you mean?
If in any case nothing is done about the allowances are not there, what is next for the intern doctors?
So, what would they expect? How would they expect us to be commuting from our residency to the workstations? How would they be expecting us to be able to feed when we are doing these non-stop duties? How would they be expecting us to communicate to our seniors in case of emergencies? Like the minister was there at 2 a.m. and the phone an intern. Now there's a complication, needs to consult a consultant. That needs their time. So, in other words, the key is within their hands to enable things happen. We don't want to, really to go into slavery because we know I cannot aid something that is a danger to health. Because if I'm unable to facilitate in all those aspects, it is really impossible for me to execute my service properly. So it's better I don't risk than risking and end up in jail or perhaps regretting. Yes, so basically that is it. And I hope our leaders and the government are following up on this. We do have hope that you listen, and you've been listening to our cry and our calls and our demands. Yes, otherwise I cannot commit that I will be able to help in destructing the health and perhaps acting as a danger. Yes, in case I'm not being able to be enabled to do the rightful thing. Yes. We
are, of course, running out of time, but we've been with Dr. Chirunda that has been stressing some of the matters that our intern doctors are facing. And, of course, behind the title intern doctor is a young doctor with a lot of responsibilities: food, rent, family responsibilities. Some are parents in their homes, some are big brothers and big sisters that are taking on some responsibilities, and they don't need these allowances. And Dr. Chirunda has also went on and stressed the fact that these are not students, just like most of the people are thinking. These are doctors that have graduated already, but have that one particular year that they have to practice in hospitals, and a lot of responsibilities they do take on. They do work for long hours, just like any other doctor. That and more conversations that we shall be having in our subsequent discussions. You've been watching TV1 New Day in particular. Until next time, see you tomorrow. Next, same time, same station, same people. Bye-bye.
Thank you.